Hey, what's up everyone? It's Raj from 3CB Performance. Today's episode I'm looking at the low back surgery that Dwight Howard had. He's been dealing with back issues all preseason, and now finally he had what's known as a L4, L5 microdiscectomy. So L4, L5 actually refers to certain bones that are in your spine. These bones are vertebrae all throughout your neck, mid-back, lower back, down to near your butt. And so they're numbered all the way from C1 down to S3. And between these vertebrae sit these little jelly donuts. They're hard on the outside and they're soft on the inside. These are the discs. Now you have nerves running out through the canals that are from the vertebrae and out to your body. In Dwight's case, specifically at L4, L5, he's been having issues with his glutes, and that's specifically where the gluteal nerve runs. So what happens is, if that disc starts to leak out, it can begin to impinge on that nerve. As you can see in this picture, it's herniated, pinching on that nerve, which then leads to some of those problems. Now, what he's going to have is called a microdiscectomy. Essentially, what they're going to do is with tiny little instruments, and they're going to go in and remove the piece of the disc or jelly that has come out. They remove it, and so take it out. Now the nerve isn't being pinched anymore, and they go in and they get rid of the opening, and look, things are all good again. The nerve is doing okay. Now the average return to play here is 10 to 12 weeks. His team has said 2 to 3 months. That's awfully optimistic. Even if you look at their research, only about 50% of people come back at 3 months. Now, however, generally, most players do return after this surgery, so it's not a career ender or anything. The one thing to be wary of with Dwight, he's had back issues in the past. For example, in 2012, he had a herniation as well. So this may be an indicator of some biomechanical issue that's affecting his spine. Alright, so that does it for this time. You can always find me at 3CB Performance on Twitter or Instagram. Find a full compilation of my stuff at the Injury Insight, or visit my clinical site at 3CB Performance.